Everyone, let's talk about chapter 13, Otosclerosis. ठीक है? And otosclerosis is basically a condition of the inner ear, specifically the bony labyrinth. And the second name of this condition is otospongiosis. ठीक है? And when I'm done explaining what this condition is and the pathogenesis of it, you will understand the naming quite well. ठीक है? जो बोनी लेब्रिंथ है ना, उसको हम ऑटिक कैप्सूल भी कहते हैं. एंड यूल प्रोबेबली रिमेंबर दिस इफ़ यू रिकॉल योर स्टडीज़ इन एम्ब्रियोलॉजी. ठीक है? ऑटिक कैप्सूल से बोनी लेब्रिंथ बनता था. जो बोनी लेब्रिंथ है ना, एक दी ऑटिक कैप्सूल, उसकी 3 लेयर्स होती हैं. इट्स बेसिकली अ बोनी स्ट्रक्चर. जो मिडल लेयर होती है ना, दैट इज़ नोन एज दी एनकॉन्ड्रल लेयर. ठीक है? एंड नॉर्मली देयर इजंट मच चेंज इन द एनकॉन्ड्रल लेयर थ्रू आउट द लाइफ ऑफ एन इंडिविजुअल. ठीक है? लेकिन ऑफन टाइम्स बेसिकली ऐसा होता है, ठीक है, इन मोस्ट इंडिविजुअल्स ऐसे एरियाज होते हैं, ठीक है, जिनको हम कहते हैं एरियाज ऑफ कार्टिलेज रेस्ट. ठीक है? एंड दीज कैन बिकम एक्टिवेटेड बिकॉज ऑफ सम नॉन स्पेसिफाइड फैक्टर और a non-specified trigger to form new spongy bone, something which normally shouldn't be happening. Now this whole concept must seem quite confusing to you, but अगर आप general anatomy के बारे में सोचें, which we studied in first year and a bit in second year, there are basically two forms of ossification or two types of ossification, and the first type is known as cartilagenous ossification, जिसमें initially एक cartilage का ढांचा होता है जिसमें bone is laid down, and इस तरह formation होती है bone की. So it makes sense कि if there are areas of cartilage rest in the enchondral layer, it makes sense that something could trigger them to basically start forming spongy bone again. ठीक है? इसीलिए otosclerosis को हम otospongiosis भी कहते हैं. I will repeat. The bony labyrinth is also called the otic capsule, and the bony labyrinth has 3 layers. The middle layer is known as the enchondral layer, जिसमें cartilage के rest present होते हैं, and sometimes because of poorly understood factors, these cartilage rests can be triggered to start forming spongy bone again, hence the name otospongiosis. Now that we have understood the basics of the pathogenesis, let's talk about the most common areas of the bony labyrinth where all of this happens. ठीक है? One very important area is something known as the Fistula Anti-Fenestrum, and I'm not 100% sure about the spellings, ठीक है? But I'll basically write them down. There's an area called the fistula, not fistula, Fistula Anti-Fenestrum. Alright, note the spellings, and that's basically it. There's also an M basically. Yep, Fistula Anti-Fenestrum, and this is one particular area which is actually located in front of the oval window. ठीक है? And I'm hoping you know what the oval window is. ठीक है? And this site, known as the Fistula Anti-Fenestrum, is located just anterior to the oval window, just in front of it. And this is basically a part of the bony labyrinth where there are a lot of cartilage rests in the enchondral layer, and which is the area most likely to get activated to produce new spongy bone. ठीक है ना? So this is the reason you need to remember the name Fistula Anti-Fenestrum, जो कि oval window के basically सामने present होता है. And it is the site of predilection for stapedial type of otosclerosis. Otosclerosis की 2-3 types हैं. By far the most common is stapedial type. ठीक है? There are a couple of things you must understand about otosclerosis. Alright, so the couple of very important things you need to understand about otosclerosis is the letter F. ठीक है? Because a patient who comes to you with otosclerosis is likely going to be a female between the ages of 20 and 30. ठीक है? Because otosclerosis is definitely more common among women, ठीक है? Especially women within the range of 20 to 30 years of age, ठीक है? and it is a familial condition. To be exact, this is an autosomal dominant trait, but because this autosomal dominant trait has incomplete penetrance and variable expressivity, that means that not everyone from a particular line will actually express the condition, okay, but they will have the gene and the potential to express it, okay, na? So remember the letter F whenever you think about autosclerosis. F stands for female, and the F also stands for other than female, it stands for familial, ठीक है. ये एक MCQ आ सकता है जिसमें आप पूछ सकते हैं कि इस particular trait की inheritance कैसे होती है. So you have to remember it is an autosomal dominant trait, but it has incomplete penetrance and variable expressivity, and it is far more common among women compared to men, ठीक है. That doesn't mean every female in a particular line will have the condition, but she will certainly have the potential to express it, ठीक है ना. So the letter F is important, ठीक है. इसके अलावा क्या चीज़ आपको पता होनी चाहिए? We've already talked about the pathogenesis, the fact that this is a condition of the aortic capsule, specifically of the enchondral layer of the aortic capsule, which basically contains areas of cartilage rest which can be triggered by unknown factors to produce spongy bone. We basically emphasized the letter F and the preponderance among women and the familial nature of the disease. And another thing to understand is that autosclerosis has an association with pregnancy and with the female sex hormones. Okay, this is important because oftentimes the disease presents itself while the individual is pregnant. Okay, and oftentimes that is the time of presentation, or हो सकता है that the patient might already have had signs and symptoms of autosclerosis which became dramatically worsened during her pregnancy. तो ये भी हो सकता है. There are a couple of other factors we need to consider in the etiology, but we will do so later. First of all, we need to talk about the clinical presentation because that oftentimes will come up in a scenario. ठीक है ना? So keep this particular seal in mind. Note the fact that the seal is wearing a pretty cool belt. ठीक है ना? Alright. And this seal is basically standing on a pier. I'm not sure if that's how you pronounce it. And waving at the ships which are basically leaving. Alright. So this is a mnemonic or a picture mnemonic I came up with. ठीक है? The belt basically means bilateral, and this is very important. So we have a belt wearing seal standing on a pier, ठीक है? And the belt stands for bilateral because this is a very important thing to keep in mind and a very important point that will be mentioned in any scenario that will be pointing towards the patient having autosclerosis. Bilateral hearing impairment, ठीक है? Accompanied with a condition called paracusis, ठीक है? Specifically paracusis villicei as well as progressive nature of the disease, ठीक है? So in autosclerosis we have a female presenting within the age range of 20 to 30 with complaints of bilateral hearing loss, and obviously this is conductive type of hearing loss because this is involving the middle ear cavity and not the internal ear, ठीक है? A female in her 20s presenting with the complaint of bilateral conductive hearing loss which is progressive, which is getting worse. Additionally, the patient will complain that she hears better in noisy conditions compared to in quiet conditions. यानी अगर वो noisy environment में होगी तो उसे बेहतर समझ आ रहा होगा when a person is addressing her and talking to her compared to if she was in a quiet environment and the same person was talking to her in the same tone, the same volume, etc. ठीक है? This is very important, will likely come up in a scenario, which is why I came up with this mnemonic. Wave a seal, autosclerosis, wearing a belt, ठीक है? Standing on a pier for paracusis villicei and progressive hearing loss. Conductive type of hearing loss to be specific. In addition to paracusis, there are a couple of words you will come across. For example, diplacusis, which is associated with Meniere's disease, and hyperacusis, which is associated with Bell's palsy. So you need to keep those in mind too. But this mnemonic is by far the most important one. Okay? So initially there was this particular mnemonic I found on the internet, which is Autosclerosis, and the mnemonic is CO2, where the C stands for Gerhardt's notch, the 2 stands for 2000 Hertz, and the O stands for Otosclerosis, and this has to do with the audiometric findings. So let's take it from the top. A patient will come to you, a female patient in her 20s, okay, into the ENT OPD, and she will complain to you of progressive hearing loss affecting both her right and left ear, ठीक है, यानी bilateral hearing loss की complaint होगी from a female who might be pregnant at the time, ठीक है, who is likely to be pregnant at the time of onset of the manifestations, and she will say that she is losing hearing in both ears, ठीक है, progressively, ठीक है, and will also occasionally say that upon inquiry that she hears better in a noisy environment compared to in a quieter environment, ठीक है ना. अच्छा, so when you've heard those symptoms, you might begin to suspect autosclerosis, and in your history you might ask for family history, and the patient will say that one of her aunts had a similar condition, or maybe even her mother, ठीक है, or something like that. So family history will be positive, ठीक है, and further down in your history, after you've basically taken a history of the presenting complaint as well as the family history, etc., you will go towards the examining the patient. And when you will use an otoscope in the UPD to examine her ear, you will realize that the tympanic membrane seems to be quite normal and seems to be as mobile as it normally is, ठीक है. But occasionally you might see a reddish hue, ठीक है, but that reddish hue is actually seen on the promontory, which is present on the medial wall of the middle ear cavity, but you will be able to see that reddish hue through the tympanic membrane, as you can see in this image which I took from the net, ठीक है ना. So you will be able to visualize this reddish hue of the promontory through the tympanic membrane, ठीक है, and this is known as the Schwartz sign, ठीक है, positive Schwartz sign in autosclerosis. This is important, ठीक है, and this is indicative of an active focus with increased vascularity. Autosclerosis में क्वेश्चन भी हो सकता है, एक्टिव भी हो सकता है. एक्टिव जब फॉर्म में होगा ना ऑटोस्क्लेरोसिस, तब Schwartz साइन विल बी पॉजिटिव, ठीक है. Schwartz साइन को हम फ्लेमिंगो पिंक साइन भी कहते हैं. So we have two names, flamingo pink sign and the Schwartz sign, positive in autosclerosis when the disease is active. So another mnemonic for you. So we have this black belt flamingo, ठीक है, to remember the flamingo sign, and this black belt flamingo is in an alteraction with the seal which had a belt and which was on the pier, ठीक है. So this is important. So we've talked about the signs, that we've talked about the symptoms that the patient will tell you about, the pertinent questions in the history. We've talked about the otoscopic examination and the possibility of encountering a positive Schwartz sign while performing the otoscopy, ठीक है. जाहिर सी बात है, जब आप ट्यूनिंग फोक टेस्ट करेंगे तो यू विल फाइंड कि दिस इज कंडक्टिव हेयरिंग लॉस, ठीक है ना. इसके बाद आप क्या करते हैं, मोस्टली यू गो फॉर प्योर टोन ऑडियोमेट्री. प्योर टोन ऑडियोमेट्री में क्या होगा, फिर से कंडक्टिव हेयरिंग लॉस आएगी. कंडक्टिव हेयरिंग लॉस में क्या होता है, बोन कंडक्शन इज़ नॉर्मल जबकि एयर कंडक्शन इज़ क्वाइट इम्पेयर्ड, ठीक है. हमेशा कंडक्टिव हेयरिंग लॉस में रिगार्डलेस ऑफ द कॉज दिस इज़ व्हाट यू सी. What's the interesting thing you will see in a graph of pure tone audiometry, ठीक है. First of all, as I've stated, because this is conductive hearing loss, and like any other graph of conductive hearing loss, the bone conduction curve will be normal. The ear conduction curve, on the other hand, will be affected, ठीक है. The specific thing about a pure tone audiometric graph in a person with autosclerosis is the fact that there is a notch present at about 2000 hertz. Okay, this is very important. The fact that there is a notch at 2000 hertz is very, very important. It is not something you're allowed to forget because that will cost you. This is very easy. CO2 autosclerosis, इससे आपको याद रहेगा that the notch is present at 2000 hertz. इसी तरह presbycusis में भी notch present होता है at 8000 hertz. So there are some specific things absolutely likely to come up in MCQs and an absolute pity if you get them wrong. ठीक है ना? I don't have the graph right now but you can search it up. आप देखेंगे कि autosclerosis वाले में, ठीक है, you will see a dip at about 2000 hertz. और ये जो dip होता है ना, ये एयर कंडक्शन वाली ग्राफ में नहीं होता, ये बोन कंडक्शन वाले ग्राफ में होता है. ठीक है, बोन कंडक्शन वाला कर्व नॉर्मल होता है एक्सेप्ट दैट देयर इज़ अ ड्रॉप or a notch at about 2000 hertz. And another way to remember that the notch is present at about 2000 hertz is the fact that there is a face-off between two opponents, the flamingo and the seal. Therefore, the notch is at 2000 hertz. This is something very likely to come up in an OSPE, so I would suggest you go over it with a lot of attention. I'll go over the important tidbits again. A patient who has autosclerosis will be a female in her 20s or 30s who may or may not be pregnant, more likely to be pregnant, and she will present to you with the complaint of progressive hearing loss affecting both ears, both the right and the left. ठीक है? She might also complain of having better hearing or better ability to hear in a noisy environment compared to a quiet environment, which might seem paradoxical to you. On further inquiry, she will admit to a family history of a similar condition affecting her lineage. ठीक है? And when you will basically examine her in the OPD using an otoscope, you will see that the tympanic membrane is about normal, although you might see a reddish hue on the promontory visible through the tympanic membrane, and this is called the Schwartz sign or the flamingo pink sign. ठीक है? Anyways, whenever you're doing autosclerosis, keep the belt wearing seal, standing on the pier, and the flamingo with the black belt in mind, and you probably won't have any problem remembering any of this. ठीक है? So as always, when you do investigations in a person with hearing loss, you start with the tuning fork test, which will reveal bilateral conductive hearing loss. Then you move towards the pure tone audiometry, जिसमें आप देखेंगे कि again the finding is of conductive hearing loss with normal bone curve, abnormal ear curve. लेकिन bone curve में specifically at 2000 hertz you will see a notch, and you will remember this given the fact that there was a face-off between two opponents and therefore the notch is present at the 2000 hertz mark. ठीक है, pure tone audiometry के बाद आप क्या करते हैं? You might do something like speech audiometry, जिसमें पता चलेगा कि जो discrimination scores है वो normal है. ठीक है, except in certain types of autosclerosis. ठीक है, फिर जब आप tympanometry करते हैं ना, ठीक है, तो आपके पास कैसा रिजल्ट आता है? AS टाइप रिजल्ट आता है. ठीक है, एंड आई हैव अ mnemonic फॉर दैट टू टू रिमेंबर कि ऑटोस्क्लेरोसिस में किस तरह का tympanometric कर्व आता है. वेरी इंपॉर्टेंट. ट्रीटमेंट क्या है? वी डिवाइडेड इनटू मेडिकल एंड सर्जिकल. कोई मेडिकल ट्रीटमेंट ऐसे एग्जिस्ट नहीं करता जो कि कम्प्लीटली क्योर करे ऑटोस्क्लेरोसिस को, बट सोडियम फ्लोराइड NaF has been tried to hasten the maturity of the active focus and arrest further cochlear loss. ठीक है, जो हमारे पास एक्चुअल ट्रीटमेंट है ना, डिफिनेटिव जो ट्रीटमेंट है वो सर्जिकल है, कॉल्ड स्टेपिडेक्टमी और स्टेबिडोटमी. ठीक है, जिसमें आप एक प्रोस्थेसिस का इस्तेमाल करते हैं. आप क्या करते हैं? जो फिक्स्ड ऑटोस्क्लेरोटिक स्टेपीज है ना, because as I've previously stated, the most common site for the development of the autosclerosis is a site just in front of the oval window called the Fistula Anti-Fenestrum. ठीक है, जिसकी वजह से वहाँ spongy bone lay down होती है, and because of the newly laid down spongy bone, जो stapes है ना, it becomes fixed, and when the stapes becomes fixed, air conduction is impaired significantly. तो आप इसको basically resolve करने का एक ही तरीका है कि आप फिक्स्ड ऑटोस्क्लेरोटेड स्टेपीज को रिमूव करें, उसकी जगह एक प्रोस्थेसिस लगा दें बिटवीन द इनकस एंड द ओवल विंडो. बहुत तरह के हमारे पास पिस्टन्स होते हैं, ये प्रोस्थेसिस होते हैं, एंड अगेन दीज आर थिंग्स विच माइट कम अप इन एन OSPI. तो आप देख सकते हैं दिस इज अ स्टेपीज prosthesis. It is very important for you to know this. Something that can be placed in an OSPI or a picture of it might be placed. ठीक है ना. टाइप्स होती हैं इसकी. टेफ्लॉन पिस्टन भी होता है, स्टेनलेस स्टील वाला भी होता है. क्या क्या होता है? टेफ्लॉन पिस्टन भी होता है, प्लैटिनम भी होता है, टाइटेनियम भी होता है. दीज आर ऑल इम्पॉर्टेंट. है जो ज़्यादा इंपॉर्टेंट चीज़ है ना विच माइट एक्चुअली कम अप इज़ कॉन्ट्राइंडिकेशंस ऑफ स्टेपीज सर्जरी. आप किन किन लोगों में स्टेपिडेक्टमी नहीं करते हैं. यानी अगर ऑटोस्क्लेरोसिस का पेशेंट आया है एंड आप कह रहे हैं कि एक ही डिफिनेटिव ट्रीटमेंट है, लेकिन कुछ कंडीशंस है जिसमें यू वुड अवॉइड दिस ट्रीटमेंट. Again, this mnemonic, cow to men, ठीक है. So you can like think of a cow coming towards some men or something like that. Young children, young kids में आप ये सर्जरी नहीं करते हैं. अगर सिर्फ एक कान अगर डेड ईयर है एंड सिर्फ एक ही कान बच्चा है तब भी आप स्टेपिडेक्टमी नहीं करते हैं. अगर एक ऐसा इंडिविजुअल है जो कि हाई कंस्ट्रक्शन में काम करता है या एयर ट्रैवल बहुत ज़्यादा करता है तब भी आप स्टेपिडेक्टमी नहीं करते हैं. So if the patient is a very young child, मतलब मोस्टली 20s to 30s में होता है, बट यंग चाइल्ड चिल्ड्रन कैन बी अफेक्टेड, तब आपने ये सर्जरी नहीं करनी. अगर सिर्फ एक कान काम कर रहा है तब भी आपने ये सर्जरी नहीं करनी. एंड इफ़ द इंडिविजुअल इन क्वेश्चन वर्क्स इन हाई कंस्ट्रक्शन और फ्रीक्वेंटली ट्रैवल्स बाय एयर तब भी आपने नहीं करनी. अगर उसकी टिम्पैनिक मेम्ब्रेन परफोरेटेड है तो ये एक रिलेटिव कॉन्ट्राइंडिकेशन है फॉर दिस सर्जरी. अगर वो पेशेंट अभी सफ़र कर रहा है फ्रॉम ओटाइटिस एक्सटर्ना तब भी आपने सर्जरी नहीं करनी. अगर वो पेशेंट मीनियर्स डिजीज़ से सफ़र करता है तब भी आपने ये सर्जरी नहीं करनी. या फिर अगर वो नॉइसी सराउंडिंग्स में काम करता है तो तब भी आपने ये सर्जरी नहीं करनी. ठीक है. इनको हमने रिलेटिव कॉन्ट्राइंडिकेशंस क्यों कहा है? बिकॉज जब ओटाइटिस एक्सटर्ना रिजॉल्व हो जाता है तब आप सर्जरी कर सकते हैं. जब टिम्पैनिक मेम्ब्रेन की परफोरेशन हील कर जाती है तब भी आप ये सर्जरी कर सकते हैं. सो दीज आर नॉट एब्सोल्यूट कॉन्ट्राइंडिकेशंस. देयर कॉन्ट्राइंडिकेशंस एज लॉन्ग एज द स्टेट इन क्वेश्चन परसिस्ट. मीनियर्स डिजीज़ में भी नहीं, ना ही नॉइज़ी सराउंडिंग में काम करने वाले लोग. बिकॉज जब ऐसे बंदे में आप स्टेपिडेक्टमी कर लेते हैं ना, दैट पर्सन बिकम्स क्वाइट प्रोन टू नॉइज़ इंड्यूस्ड हेयरिंग लॉस. ठीक है. ये सारी बहुत इंपॉर्टेंट बातें हैं. यंग चिल्ड्रन, सी फॉर यंग चिल्ड्रन, वेरी इंपॉर्टेंट. ओनली वन वर्किंग ईयर, इंपॉर्टेंट. वर्क्स इन हाई कंस्ट्रक्शन, इंपॉर्टेंट. टिम्पैनिक मेम्ब्रेन परफोरेशन, इंपॉर्टेंट. ओटाइटिस एक्सटर्ना, इंपॉर्टेंट. मीनियर्स डिजीज़, इंपॉर्टेंट, एट्सेट्रा एट्सेट्रा. ये सारी ये जो कॉन्ट्राइंडिकेशन है ये भी बहुत हाई यील्ड क्वेश्चन है. So what are the potential complications of stapidectomy? Starting with C, conductive hearing loss if we fail at it, and that can happen if the prosthesis gets displaced, or if the prosthesis was loosely placed, or if it was too short. That could lead to conductive hearing loss because the stapes is a very important part of the conductive ossicular system. C for chordae tympani, if you accidentally damage the nerve, which is closely associated with the ossicles, you might actually make that particular ear dead. You might damage the facial nerve. So 2 nerves which could potentially get damaged. In the incus could get dislocated. Occasionally there might be sensorineural hearing loss, etc. So 2 nerves now which could get damaged. There are 2 nerves which could get damaged, and there's basically 2 types of hearing loss. सेंसोरी भी और कंडक्टिव भी. कॉर्डिक टिम्पनी भी इफेक्ट हो सकती है, फेशियल भी इफेक्ट हो सकती है, वर्टाइगो भी हो सकता है, और पेरिलिम्फ फिस्टुला भी बन सकता है बिकॉज ऑफ दिस सर्जरी. और इनकस की भी डिसलोकेशन हो सकती है. 2 नर्व्स की डैमेज हो सकती हैं, 2 तरह के हेयरिंग लॉस, 2 डिसऑर्डर्स विच हैव टू डू विद द वेस्टिबुलर सिस्टम, और इनकस की डिसलोकेशन.